Rising health care costs are one of the top concerns in this presidential election year. Last year, U.S. health care spending grew by $156 billion to hit more than $3.5 trillion overall. That's about $11,000 per person. Now, there's been a lot of debate in the race for the White House on how to pay for the rising costs and why they're increasing. Here to help break this all down, American Action Forum President Douglas Holtz-Eakin. Douglas, thanks for joining us. It's been too long.
Thanks, Charles. Great to be on. Thank you.
It's the key issue. It was a deciding factor in the midterm elections. We hear all kinds of things, a lot of finger pointing, but where are we? I mean, is this juggernaut of medical spending, healthcare spending, can it be curbed at all?
Well, I guess the most important question is to identify which spending you're worried about. As you mentioned, the national health care bill went up by $156 billion. That's the bill. But often we have different people paying that bill. So you could pay it out of pocket, in which case premiums don't go up, or you could have insurance companies pay it, in which case they're going to charge higher premiums. If you're just looking at sort of that shifting of the premiums and the out-of-pockets and all that, you're not really dealing with the problem. So you really hope that we get some people in 2020 who are talking about the problem, the use, and the expense of delivering health care services.
Well, it's a perfect topic this morning, considering how Biden continues to gain momentum. He's saying, listen, you're going to get taxed. He says if you have household income beginning at $29,000, look for a bump in your taxes, but you won't pay premiums, you won't pay co-tails. Bernie Sanders saying you won't pay premiums, you won't pay co-pays, any of that stuff. So the trade-off is worth it. Does something like that, does that prescription, no pun intended, is that the kind of cure we're looking for?
I don't think so. So take it the extreme version, Medicare for all, the Bernie Sanders proposal. The very first thing that does is say, use as much health care as you want. So that just increases the use of health care, increases the spending bill, drives up the cost of health care. The second step in that is to say, oh, okay, we're the single payer. We'll decide how much we pay for these services, and that amounts to price control. So there are a lot of suggestions that say, well, they'll do it at what are typical reimbursement for Medicare, for example. That's $32 trillion over the next 10 years. But even at those reimbursements, there are a lot of hospitals that will lose money on everybody they treat. So that's unlikely to stick. Now the price is going up, and you're not even dealing with the underlying problem.
On drug prices, it feels like President Trump is in alignment to a degree with Democrats, that the government has to put their hand on the scale. I know you don't like that kind of intervention, but what do you say to people that see that, the drugs that they have to take every day, it feels like the prices are going through the roof?
Well, I think the concern over prescription drug prices is very understandable. But think about it. Some of that has to do with how much you're paying out of pocket, not the underlying cost of the drug. So let's figure out which one we're trying to get under control. And when we do it, let's not cut off the incentives for innovation. American medical science has been a tremendous blessing to the U.S. public. You don't want to sort of kill that off in the process. So, there's been this draconian approach that Speaker Pelosi has promoted. The White House has said properly, no, we're not interested in that. There is a bipartisan alternative known as H.R. 19. That's a bill number. But inside that are things that Republicans and Democrats can agree on to make some progress on this problem. That seems like the place to go.
Doug, thank you very much. Happy New Year, my friend.
Happy New Year.